मैंने किधर है वो PPT? A very good morning to all of you, my dear friends. Today we are going to continue in our series of lectures on pediatric dental education. The topic which we are going to discuss in detail today are the aims and objectives of periodontics and preventive dentistry, and also about the scope of periodontics and preventive dentistry. I'll just share the slides. So now we're going to start with the aims and objectives of periodontics and preventive dentistry. Now, our basic aim, what is our basic aim of periodontics? To determine what is best for the child at that moment. Now, try to understand this statement. Best for the child at that particular moment. Now, what happens many a times, it happens in our practice also, you have a child and when you open his mouth there are around 16 or 18 badly caries or very badly mutilated teeth. There's a swelling, there are abscesses, there are draining sinuses, and you see multiple problems. And then you see a set of very well educated parents also at times, and then you start wondering, why did they not take care of this child? So you tend to get very angry. This is, because this is not fair that you are educated, you can afford all possible treatments. Of course, if there is a parent who really cannot afford and has been postponing treatment for various financial concerns, then you're okay, like, okay, that can happen. But in such a situation, so there might be varied reasons for that. So don't get into the mood of shouting at the parents or scolding them. No, it's no point. At this correct juncture, determine what is best for the child and start off with the treatment and whatever the necessary things are. Okay. And the second aspect is what is best for the adult into whom the child will eventually grow. So now the child came with multiple problems. So now your role becomes very, very critical. So now you have to make all efforts about educating the child, educating the parents, and seeing to it that he his overall oral development, the development of the teeth, related structures, and there is no disease re-happening ever again. Your attempt should be such that this was the first and the last time that he visited for such multiple treatments. That should be technically his last visit. So that from the next time when he comes for his follow-up visits, he just comes for a follow-up and basic care. All that he would require is basic care. So our aim is what? To determine what is best for the child at that moment and what is best for the adult to whom the child will eventually grow. Then comes the objective. So as a periodontist, the overall health of the child should be a primary concern because oral health is an integral part of total development. Because they say now that the mouth is the mirror of the interior of the entire body. And actually, depending on how good the oral health is, the general health also will simultaneously be good or bad. Suppose you've got multiple caries teeth, lot of pain and swelling, so he might not be able to eat properly. And if he doesn't eat properly, if he doesn't chew properly, what will happen? A series of other problems will also arise. So our aim is that make the oral health so good that it facilitates the overall development also. Then the second most important objective is prevention. There is an age-old saying, prevention is better than cure. Now, in children's dentistry, I'm telling you, it is not so easy to treat a child. There are variety of factors, variety of children coming to you, and majority of times it can be really difficult to do the major treatments. Okay, so and the best part is that the preventive treatments, namely the fluoride application, the pit and fissure sealants. All these treatments are very simple, painless. There is no discomfort. Okay. So if the child comes for that, there will be not much stress on the dentist and also on the child. So your focus should be prevention because all the preventive procedures are very, very simple, nothing complicated at all. Then the third part is comprehensive oral health care. When we are talking about comprehensive means, don't just treat that one single tooth for which the child has come with the chief complaint. Your aim should be to treat the entire oral cavity. You should, if there is a painful tooth, there is swelling, you might do an extraction. There is always a possibility that the patient might just go away. after the pain has been taken care of. There are many a times the patient comes swelling and severe pain, not being able to sleep for 2 3 nights, and then he comes. You do a little bit of treatment and you give him the antibiotics and analgesics, and his pain is relieved. Then it is. Then he comes after again after 6 months when the pain reappears. So remember one thing: the dental patient who comes to you, okay, generally they come when they are in severe trouble. Okay, that's the trend which we have seen all the time. So your focus should be that comprehensive oral care. You have to make the parent understand. Okay, see, this particular episode which happened with you can happen again. And you should show all the other things. These teeth is also bad. This one is also bad. So this can cause a lot of problem, whatever you face just now. So whenever they come in severe pain, that also is the right time to explain the importance of dental care and try to do as much treatment as possible and then focus on the preventive. Then see the developing dentition, the child is growing, okay? So you need to monitor it. And if you find any abnormality, you should be able to inform the parent about it and start with the required treatment. I'll give you a very simple example. When children have their milk teeth, when they're 3, 4, and 5 years old, that time there's a lot of spacing in their front teeth, that is the anterior incisors. Okay, spacing is common. Because why is the spacing present? Because the permanent incisors which will come, they are bigger in size. Okay, and since they are bigger in size, they require more space. That's why there is spacing to create, make the space available for the permanent incisors. So now, if you see a child whose there is no spacing present in the upper anteriors, upper incisors region, so that is a cause of worry. So you have to follow it up and monitor that child, because there is a great possibility that there will be crowding or malalignment in his teeth. So that should be kept in mind. Then needs to update his knowledge to deliver quality dental. Now, as they say, upgradation is very, very essential, and especially when you are doing treatment for the child. Okay, two things are very, very important. One is the pain component. So all methods and devices which can remove or reduce or eliminate the pain should always, you should always be searching for that. So that is a major objective, to find pain-free objects. For example, an injection. Everybody is scared of an injection. Okay. So for example, in my practice, I have something called as an STA. That is a wand device. It's a computer-assisted anesthesia delivery system. It is absolutely painless, or I can say pain-free. So you should be on the lookout for all these kind of devices. Then there are a lot of material. And the second focus after injection is the time duration. So anything and everything that will take care of the pain, that will take care or reduce the time component, your focus should be in there. Because see, we have to understand that the child can't keep his mouth open for long hours. I mean, 1 hour, 2 hours, it's impossible. The child will, a cooperative child can become extremely uncooperative. The maximum time that you need to be working in the child's mouth should not be more than 10 to 15 minutes. Okay, and you work for 1 hour, 45 minutes, or 2 hours, then a good cooperative child, laughing child will start crying, because there will be fatigue setting in, there will be boredom. Okay, so focus in your knowledge upgradation should be on painless things and pain-free gadgets and devices, and utilization of all those materials and equipments and devices and instruments that will reduce the working time. Now, one more important aspect, because periodontist should be a well-trained psychologist. He should be well versed in the subject of child psychology. Okay, and behavior management is the most important criteria in pediatric dentistry. If the child doesn't sit on the chair, if the child doesn't open his mouth, what further treatment are you going to do? Nothing at all. So it's all about behavior management. And there you should be able to remove his fear and anxiety. And not only the child's fear and anxiety, but even the parental considerations. Because different varieties of parents you will bump into, and they will have different views and feelings for their children. So that also has to be kept in mind. So a periodontist should be well versed in behavior management, and his knowledge about child psychology should be perfect. And of course, there will be variations, there will be permutation in combination, but thorough knowledge in the field of child psychology is a compulsory aspect. Okay, because if the child opens his mouth, then the further things can start. Then parental guidance and counseling regarding different facets of preventive dentistry and treatment modalities. See now, parents, they are one of the most important people for the child. And once the parent is convinced, the child will definitely follow. So parental guidance is very essential because see there are certain age-old concepts which are floating everywhere. Many people think milk teeth are not important. So why work hard so much on the milk teeth? So they will say remove the teeth. They might not accept various treatment modalities. So when you're talking with the parents, you have to explain about all those aspects, the importance of milk teeth, the role of the milk teeth in function, the role of milk teeth in overall development, the role of milk teeth in speech, everything you need to inform the parent about. Then only they will be convinced. And you'll have to give them feasible options also. Because now, luckily, as far as the cost factors are concerned, variety of materials have come into. So rarely can anybody refuse treatment. So you have to guide the parents and counsel them. You just can't say, oh, parents don't agree only. Whatever misconceptions, whatever varied information which is there in their minds, you need to correct it and insist that all that you are doing is for the benefit of the child as a whole. Then, of course, in pediatrics, also the overall goal of producing a proficient specialist in pediatric dentistry. See, as a teacher, my aim is to produce an excellent, well-trained pediodontist. So the specific objectives of the postgraduate programs are such that a variety of things are included so that right from birth to adolescence, the pediodontist can manage well. And the other important aspect is to ability to educate and guide the parent. I discussed this point a little in brief previously also, that so that they can accept various treatment modalities and they accept oral health care with the preventive aspects also. So oral health care, see, doing a good filling, doing a good crown, doing a good appliance is great, but post-operative care is very, very important. If everything is not maintained well, then what is the point? So post-operative care, oral hygiene instructions have to be clearly given. Diet and nutrition has to be taught very much in detail because diet and dental caries is very closely connected. And we all know that sugar is the arch criminal. Then mastery of the restorative procedures in primary and young permanent teeth required to treat children and adolescents. The techniques have to be proper. Okay, techniques is very, very important. You should be abreast with the latest techniques, with the latest gadgets. Okay, and you should have a vast variety of material with you. Okay, because every child's requirement would be different. In some child you might use X material, some child you might use Y material. So a variety of material should be there, and the knowledge about that material is there because anything and everything that, as I mentioned earlier, reduces the time, enhances the longevity of the restoration is very, very critical because the material technically has to be rough and tough. Okay, we are not working on an adult where he will sit and keep his mouth open for hours together and you can really do artistic work. Here you have to do artistic work, but it has to be very quick. And the material should be rough and tough in the sense it should be very, very durable. Because remember one thing, when you give 5 to 10 post-operative instructions to the adults, they follow 75%. And here we have a child, even after giving 10 instructions repeatedly, the probability that he may not follow any of them is very high. So your material choice should be such that they should not require a lot of maintenance and care. They should be, able to stay and withstand whatever difficulties that might be faced later. Then understanding the physical and chemical properties of medications and dental material used in treatment and their physiologic responses of the child and adolescents to these agents. Then we should have a comprehensive knowledge about pediatrics also. Yeah, because pediatrician and pediatric dentist, they have to know everything about the child. The pediatrician knows everything except, the tooth teeth structures, they might not know much. But you should have a lot of knowledge about various other aspects of pediatric medicine also. Okay, and then oral pathology and oral surgical procedures applicable to the child patient, because you might bump into cleft lip, cleft palate patients. You might be called in to assist because you being a pediatrician, you know so much about the child. Then finally, capability to diagnose and treat traumatized and carious primary and young permanent teeth to maintain the tooth pulp, tissues, and periodontium in a healthy state. Traumatic injuries is very, very common in children, and knowledge about trauma is of utmost importance because children are on the playfield, on the playground, in the gardens, they will fall. You might receive an emergency call. Okay, what do I do? So your knowledge has to be perfect. Okay, Baba, this is what you are going to do. Step one, step two, step three. And then finally, ability to provide comprehensive oral health care for medically, emotionally, mentally, or physically challenged patients. Yes, special children also come in the umbrella of pediatric dentistry, and one of the main objectives of pediatric dentistry and one of the main objectives even in the definition is taking care of special children. And then of course growth and development you should know, so that you can either prevent any malocclusion from happening, or you can intercept the malocclusion if it is formed in its early stage, or be able to send it for corrective orthodontic treatment also. So any growth modulation procedures which are there related to growth and development, you should be able to see it and suggest or recommend suitable treatment. And finally, ability to control the pain and anxiety through the use of psychological and pharmacological methods, including provision of dental care in a hospital. Now, see, adults are generally treated on the dental chair, but a child patient for that matter, at times, if he's not sitting only on the chair, he's extremely uncooperative, or he's a special child, or he's a child who is, like so small, maybe a 1.5 year old, that he's not in our this, that he will not in that age group where he'll understand our various methods of explanation. And sometimes these kids require a lot of dental care. Multiple sittings might be required, and it might be very difficult to perform treatment for these children. So in such situations, you might have to do the treatment under general anesthesia in the hospital setup. And of course, general anesthesia is the extreme part. There might be a lot of sedative agents also available. Then there is nitrous oxide oxygen method also, that is the laughing gas method. So you should be able to utilize these pharmacologic and of course the non-pharmacologic behavior management techniques to take care of the child. And then preparation for managing a contemporary pediatric dental practice. Now, the objective of periodontics is to train you to set up a proper periodontic practice, the interiors of the clinics, okay, the various gadgets which will be required, the color matching, the type of chairs, everything, including the auxiliaries, the people who are going to assist you, your dress codes, okay, your reception area, everything has to be different. It cannot be like an adult clinic. It has to be different. It has to be child friendly. And there has to be a lot of provision made for special children also. So, and of course, the last aspect is marketing, because periodontics is a relatively new branch. It's not that the kids never existed and suddenly kids have started existing now, but pediatric dental problems are on the rise. So you have to make people aware. You see, like how there is pediatricians, which is available for children's general treatment, there is a periodontist or pediatric dentist or a children's dentist available for children. So you will have to create that awareness, because a general dentist cannot manage all children. Pediatric dentist is always better for that. And finally, coordination of all the above objectives such as diagnosis, case analysis, treatment planning, and clinical management of orofacial health problems that occur from infancy, childhood, and adolescence are grounded in a sound application of scientific knowledge that remains state of the art through development of an attitude towards lifelong inquiry and study. You have to be always inquisitive. You should always be in the search of methods, devices, equipment that will facilitate the treatment of a child. And of course, you have to be well read also. You should go through a lot of literature. That is again the objective, that You have to be familiar with the published literature pertaining to pediatric dentistry and the motivation to remain abreast with and critically evaluated dental literature. Because a lot of studies and research is going on. So you have to keep an eye on that also. And finally, there should be a commitment to implementation of individual and community prevention programs aimed at dental and systemic diseases and traumatic injuries. Now we come to the next topic. The next topic is responsibilities of a periodontist. And these are basically divided into three main groups. One is the responsibility towards the patient. What all responsibility as me? I'm a periodontist. I have towards the patient. Then what is my responsibility towards the community? And finally, what is the responsibility towards my own self or herself? Okay, so this topic we will cover along with the scope in periodontics in my next lecture. Thank you so much for your precious time.